Committee, if we can start the meeting. The first item on the agenda is election of chair. Do I have any nominations?
Could I nominate Edna Murphy, please?
I second that.
Do I have any other nominations? In that case, Councillor Murphy, can I ask you to take the chair?
Thank you very much. Welcome, members, to the Staffing and Appeals Committee, 7th of November. Just to say that, as you know, the County Council allows filming and photography at its public meetings, so please feel free to take pictures and use social media during the non-confidential part of the meeting only. Can I ask, though, that everyone present turns their mobile phones to silent or vibrate, please? And please be aware this meeting is being live streamed and a recording will be available on the council's website. There's no fire alarm scheduled for today, no testing scheduled for today. So if an alarm sounds, the meeting will adjourn and we'll all make our way downstairs out of the main entrance and turn left. The muster point is at the far end of the building, which I hope everyone is familiar with. So we now come to the matter of the election of the Vice Chair. Can I please have nominations?
I'd like to nominate Mike Black, and if it's possible to do it in his absence, which is always the best way to get people to do things.
Thank you. Do I have a seconder? Thank you, Councillor Netzinger. And are there any other nominations? Thank you, Councillor Shaler. In his absence, he's elected in his absence, and in his absence, would you like to sub for Vice Chair, please?
Oh, we don't do subs.
Oh, don't do subs to Vice Chair. Right, I take that back. I'm on my own. Indeed, absolutely. So can we please, if I can ask the Democratic Services Manager, please to report any apologies for absence.
Yeah, we have apologies from Councillor Black and Councillor Shaler is substituting.
Thank you very much. Does any member want to disclose, declare any disclosable pecuniary interest or non-statutory disclosable interest? Now, it's important to ask that question every time, but there is no one forthcoming on that. Item 4, we're being asked to approve the minutes of the 2 meetings which took place in March, the 24th of March, as the correct record. Can I ask any member who doesn't agree with this proposal to raise their hand? I see no hands, so there are no objections to the proposal to approve the minutes as a correct record. Thank you very much, colleagues. So now we have our first substantive item on the agenda, please, the People Strategy Update. Can I ask the Head of Workforce Strategy and Policy Manager to introduce the report? Thank you very much.
Thank you, Chair. Hello, good afternoon, everyone. The committee today is asked to note progress made in engaging with colleagues on creating an action plan that will support the delivery of the commitments that we've made in our people strategy, and to endorse the proposed timeline for presenting a final action plan to this committee in February. You will be familiar with the people strategy, and since it was approved by full council, we have been undertaking listening activity within the organisation to help us support shaping an action plan to take forward that people strategy over the coming years. And that's laid out in the report you'll see today with the appendix of the full people strategy. Section 2 describes the activity that we have been undertaking. And some of the examples there are focus groups that took place with colleagues from across the organisation, asking for their views and ideas on what might form an action plan to take forward our people strategy. And we had 7 sessions in total with a mixed attendance from across the organisation. We asked colleagues to look at the themes that were in the people strategy: attracting you, supporting you, appreciating you and developing you, and asked them about what they felt the council was doing well and where they felt that there were gaps that could be addressed. We've also set out there in section 2 some of the feedback that's already been addressed, because this is not a static position. We are always working on what we can do to respond to feedback that we're hearing. And some of the examples of that, one of those, the desire for a clear position on volunteering, and that volunteering policy has been launched within the organisation. We also have undertaken some engagement sessions within adults health and commissioning, and I was at a roundup session with colleagues there today, and that's been taking place over the last few months, where we've been hearing from colleagues within that service. We've also had the Children's Workforce Programme, which you may have been briefed about separately. We have had a full staff survey, and we will be getting the results of that staff survey this week, and more on the outcomes of that will be shared. That was conducted externally via Ipsos, so that we were able to reassure colleagues of the independence of that survey, and we had a very good take-up rate, a 54% response rate, which we felt was therefore representative in terms of colleagues' views within the organisation. So we shall be looking at themes that came out of that in shaping our action plan for the people strategy. And we also benefit from colleagues in the recruitment team who are undertaking interviews, exit interviews with leavers, and that can give us a really good insight in people's experience of the organisation at the point of leaving. So we want our people strategy to take us from people joining to people leaving, and there's some very useful information that has come out of those sessions. The next steps in terms of our people strategy action plan would be to, as I said, to look at that report from Ipsos, looking at the insights and recommendations from the employee survey, consideration by the council's leadership team, and sharing with our internal networks, including our trade unions at CJP and the Ideal Committee. And I understand that the Chief Executive will be briefing chairs and vice chairs. In December, sharing those outcomes with the wider workforce and seeking more detailed feedback on areas where we can see that priority attention is needed to support the drafting of the action plan. We would then anticipate sharing a draft action plan in January with CLT, with our trade union colleagues and with our internal EDI network, Ideal, and presenting an action plan back to this committee in February 2024. Thank you.
Thank you very much. Do I have questions or comments? Councillor Hunt.
Thank you. I'm probably completely stupid with this one, because it's the first time I've been to this committee. I'm been looking at your volunteering, where people are allowed 37 hours a year to volunteer, and it looks to me as though this is something that's already been agreed and it's in progress and in chain. But my concern was, who decides? When I read this, I just thought, I'd say, who decides what organisations that support our vision of the vision and values? Does an employee have to apply to the next step up the food chain or something, or can they just say, oh well, I'm going to the sort of Bill Hunt Appreciation Society and I'm going to go volunteering there? And so, could you tell me how it happens?
Of course, thank you, Councillor Hunt. And this is my first time as well, so we're new together. I don't think it's a stupid question at all, and it's something that we have covered in the detail of the volunteering policy, which I appreciate you don't have sight of. But we are trying to make the organisations that people would volunteer for ones that fit with the council's values and ambitions, and where they are either based in or working within Cambridgeshire. And if there are questions on that, we ask for colleagues to talk to their line manager about that. And I think we need to, because this is a new policy, to listen to how that goes and whether that preventing any issues.
So they would go to their line manager and say, well, I want to go and do some volunteering for, say, the food bank in Peterborough. The manager would say, oh yes, that's a thing we would support, so that's fine.
Yes.
But I'm concerned that there might be some other organisations that people might go volunteering for, which would be inappropriate, and it seems doesn't seem to be pinned down too well in here.
I think I am on here. I have got a light. Yes. No, it's not pinned down in the detail of this paper, but we could provide the detail of the time off for volunteering policy outside of this meeting. If that would help.
There is a
Because
safeguard.
it is set out a bit more in detail there. Yes.
Okay, thank you.
Okay.
Thank you very much. It's helpful to have it clarified that there is a policy behind this. Yes, thank you very much. Councillor Netzinger.
Thank you. My question is also on the volunteering stuff. Actually, I'm really pleased to see that there. I think it's a really good policy for this council. I think we, as a council, quite often depend on groups which involve volunteers. They can be enormously helpful to our work, and it's therefore appropriate that we support volunteering as an ideal. I think it would be helpful for members to be able to have sight of the whole policy. So maybe you could, as an action, send that round to all of the members of this committee, because I would really like to see it too. I was also wondering, I mean, I know it's a new policy, so there won't be loads of uptake from it yet, but are you going to be gathering information on how much people use it? Because it will be interesting to see how many people take it up, and to a certain extent what they choose to do with their volunteering time, because it will tell us things about our staff. So I was just wondering how you're going to be monitoring it, really.
Thank you. Sorry, a bit new to this. Yes, we will be monitoring how much time colleagues spend. The question about whether we're monitoring the organisations that they're volunteering for in terms of being able to break that down is one I'll need to take away, because I don't know that we're already set up to monitor that, but we might need to do that in a more of a qualitative way. But I'll take that away and have a think about that with the team. Thank you.
Thank you very much. Is this a direct response? Thank you.
Thank you, Chair. It's just to supplement some of the things that Anna's already shared with the committee. And yes, we will circulate the policy. Back to Councillor Hunt's question, there is already a pre-existing website for Cambridgeshire that outlines volunteering opportunities across the county, which the policy links to. Equally importantly, there are 5 volunteer centres across Cambridgeshire, which we point our employees at, whether that's the Cambridge Council for Voluntary Service, the Volunteer Centre for Huntingdonshire, Voluntary and Community Action for East Cambridgeshire, Volunteer Centre Peterborough, or Volunteer Centre Fenland. So those all tend to help channel our employees towards the types of voluntary activity that not only are focused within the county, but are ones we would support and work with. And whilst it's frankly impossible to have an exhaustive list of all the organisations that people might choose to volunteer with, we do try to provide examples and guidance as part of the policy and work with the organisations we're already commissioning in some other parts of the council. Thank you.
Thank you very much, Councillor Billington.
Thank you, Chair. I'm knowing the Chief Executive, I'm sure this has been covered off, but in relation to the car sharing scheme, I would not assume, but presume that any person who is the driver will have the appropriate insurance. I'm sure the nodding was, and please, I asked the question anyway. Thank you, Chair.
Thank you very much. Any other comments about the, would you like to comment? Thank you.
Yeah, just to confirm, we do require everyone annually to produce their driving licence and insurance documents so that we can double check if they're driving for business purposes that those documents are legitimate and there's no disqualification. Thanks.
Thank you very much. Some of the points raised in this report will be covered in more detail later. Councillor Shaler.
Thank you very much, Chair. I also very much support the voluntary aspect. And from a member's point of view, it's quite obvious this way that we interact with the residents, you know, has clear appeals. A question that I have is around the corporation as a kind of a big family. I travel around the county on highways, various things, and drop in at libraries and different places where we have present, and it does have that feel, that very inclusive feel to it. And I think this appeals to our workforce. The question relates to the changing way that people are working at home. Is there, have you seen a shift? Is there a provision to utilize that aspect of the way that, you know, the kind of organization that people want to work for, the way that they feel included, that sort of thing?
Thank you. There's a couple of things spring to mind there. One is that we asked in the focus groups and also in our employee survey for colleagues to give us words that to them represented the kind of organisation they want to work for and also that they feel. And some of the early indications are that things like friendly and caring have come out. So I'm really pleased that you've witnessed that sort of sense when you've been out and around, especially in various different teams around the county. And I think that's something that for us as an organisation, not to make any assumptions about what we might want from an action plan, but were we to sort of try and build on that, I think that would be a really nice element. In terms of your question about working remotely, what we have heard is people appreciate opportunities to come together and opportunities to have what we might call downtime together, you know, the sort of making a cup of tea, you know, chatting in the office, maybe going for lunch or coming together as a team. So I think there will be a balance of how we make sure that managers support those things to happen in physical workspaces, and also acknowledging that we have some way to learn about how to facilitate that in the virtual space as well. So I would anticipate both of those things being part of what we might bring back to discuss more about how we keep that culture and build on how people feel about Cambridgeshire.
Thank you very much. And some of the things we'll talk about later, I think some of the metrics that have been highlighted in the appendix, for example, do show that there are pressures on staff, certainly, with turnover and with the sort of metrics that you would expect from people who are working under a great deal of pressure, which is unsurprising coming out of the pandemic and must be very common elsewhere as well. But we can talk about those in more detail. I think the thrust of this session is to, following the excellent presentation, is really to focus on, you know, the progress that's been made in developing the strategy, and if we agree to endorse the proposed timeline to deliver an action plan, which has been set out. So unless there are further comments, how do we feel about those two proposals? Is everyone happy? Thank you very much. We'll take those as given. Thank you very much indeed. For our next item, the workforce profile update, where we get into the more nitty-gritty of the data. Janet, would you like to present this, please?
Yeah, thank you, Chair. So this update has come out of a discussion that we had, those of you who were here at the committee in February earlier this year. On an annual basis, when we bring the statutory reporting information in February, we also do a more comprehensive report about the workforce profile. And in February of this year, we were asked, could we bring a sort of an interim update report? So this is not the full report that you would normally get in February, and we'll get again next February, but it's something of an interim report to give you an indication of how things are looking mid-year. I'm actually going to ask Caroline to present this. Caroline Adu-Bonsra, who's written the paper and is our head of HR and recruitment. So I'll hand over to her to take you through the key points in the paper. Thank you.
Thank you. Good afternoon. Hope you can hear me. Do you want me to go a bit closer? Sorry. Oh, okay. Is that better? Thank you. Yes, so I just wanted to bring some sort of highlights of the paper. You've obviously had it to read, but overall at the moment, whilst we are seeing turnover in some places higher than we'd want it to be, it is coming down over the entire organisation. So we're down nearer to 12% after being around 15% following the pandemic. So that's a positive. For the February report, I think we'll bring a lot more detail about where the turnover is, where the age ranges are, where the trends are sitting, and link it back to length of service as well, because I think that'd be interesting. I think the wellbeing offer that we now have in place has contributed a lot to this reduction. It's also contributed to a reduction in absence that we're seeing as well. So we are starting to see a lowering in the instances of mental health, stress and anxiety being key reasons for people to be absent. So again, that's positive. In terms of sort of information points, you'll see that 69% of our workforce are over 45. And I think in February, we'll have a look again about a bit more detail about the breakdown of our workforce and what that will mean for us. In terms of recruitment, I wanted to highlight that we now have had our new recruitment system running for a year, and we've seen a real increase in the number of candidates that have been accessing that system, and we're also hearing it's an improved experience from a recruitment manager's perspective and also from a candidate's perspective. We are using that system proactively to reduce barriers, to try and increase applicants from diverse backgrounds, people who would have previously found our system too difficult. And we will continue to monitor that. We haven't had statistics previously on recruitment, so I think to be able to access that will be really useful as well. Challenges wise for us, there's plenty, but recruitment of the right skills and experience continues to be a real challenge for us. There are certainly some areas within the organisation where we are finding that much more challenging than others. We also want to continue to increase our diversity. We continue to work with our Ideal network. We use different job boards now. We make sure we write adverts in a way that doesn't inadvertently exclude people. And also we need to support our employees in what is in a challenging economic times for them. So a variety of challenges, really. Thank you.
Thank you very much, and a really interesting. I mean, this report, just to remind members, was brought because we felt we needed some information between meetings, not just every year, so that we could see what was happening and have an opportunity to respond, rather than wait till much after the, as it were, the horse has bolted. So it's very welcome. It's got loads of really interesting detail. Who has questions or comments? Councillor Batchelor.
Yeah, thank you too, if I may. Firstly, so the number of employees we have, 4,746, is that permanent members of staff, or does that include temporary and agency staff that we contract in on a short-term basis? That's one.
No, that's just our permanent members of staff. Yeah.
And second question, under long-term absence, it's quite concerning to see that 25% of those are related to anxiety, mental health, or depression. I mean, in terms of actual numbers of staff that 25% relates to, do we know what that is? And essentially, what are we doing to try and combat that? Because that seems to be significantly higher than the second reason for a long-term absence.
Yes, thank you. So what we do notice is that for our members of staff that have been off for a lengthy period of time, that tends to be the primary reason for their absence, which is why it then becomes a higher reason for absence. So yes, we will know how many people that relates to, and I can certainly bring that back in February in more detail for you. We will absolutely be working with anybody who has been absent for 21 days or more and is citing anxiety, mental health or stress as a reason, and supporting their manager to make sure they are supported to either return or access the support that they need. So I would sort of reassure you that we certainly know who they are and we will be working with them. Yeah.
Thank you. I've got Councillor Hunt and Councillor. Oh, would you like to intervene at this point? Yeah.
If I may, before we move off that point, I think it might be worth just bringing Anna in on that point as well, because Anna's also has responsibility for wellbeing, and I know has worked really hard on some of the tools and resources that we make available, including the Maximus service. So I just think it might be quite helpful for you to just share a little on that, if you don't mind, Anna. Thanks.
Yeah, hello. So in terms of things that we do to support colleagues with who are absent due to mental health, including anxiety and depression, we do work very closely with Maximus, which is the government's funded access to work service that's specific to supporting mental health on a one-to-one basis, and we promote that, and it's got a good take up in the organisation. Our EAP service has about a 20% utilisation rate within the organisation, which is very high compared to other organisations that I'm aware of anecdotally in the system. We have training for colleagues and line managers around wellbeing, understanding their mental health, having conversations with colleagues about that. And we are introducing in the organisation an intervention called Schwartz Rounds to allow colleagues who are in services where there's a bigger emotional impact of work to reflect on a monthly basis on that. So there's a number of things that we are doing and that are being well used within the organisation, because we know that we don't want those absence reasons to be any higher than they need to be. So thanks for your interest in that.
Thank you. I believe you have one more intervention. Thank you.
Thank you, Chair. Just following Councillor Batchelor's question, the issue of sickness absence overall, because of course the report provides members with a breakdown of the causation factors for both short-term and long-term absence. In terms of just positioning that for members, our total absence over the rolling year as of 1st of October in terms of our full-time equivalent employee levels is 8.39 days per calculated on our full-time equivalency. That has seen a significant reduction from where we've been previously. In terms of long-term absence, the question from Councillor Batchelor was around the number of people who are long-term absent with stress, anxiety, depression or similar causation factors. That tends to be the highest proportion of long-term absence in almost every employing organisation, and then unsurprisingly is followed by things like musculoskeletal absence, which is again the most common cause of long-term absence after stress, anxiety, mental health issues in most sectors of employment. The converse side of that is for short-term absence, the major causation factors is colds, flus and viral infections, which again is entirely consistent and benchmarks well with other employers. So I would just make the point to members that relative to other large public sector organisations, our overall level of absence per full-time equivalent over a rolling 12-month period compares reasonably well, and the causation factors for long-term and short-term absence benchmark almost entirely consistently with other employers, irrespective of sector. Thank you, Chair.
Thank you. That's really helpful context. I've got Councillor Hunt, then Councillor Netzinger.
I think you've almost half answered that. I picked up that there was 8.39 days sick per employee per year. And I was going to say, is that average, below average? Is that a good figure? Or, you know, is the national average only 2 days or is it 20? I think you've half answered it and said it's sort of on the norm.
I think it's rather good, isn't it?
Chair, it's reasonably positive. If I compare that to other organisations I've worked with, the average in the police service was 9 days per full-time equivalent, so we're better than the police service, and clearly the nature of our roles are different to people working in the police service. If I look at it compared to the NHS, again, compares pretty well, I have to say, and relative to some other councils, it may be slightly higher, but then our workforce is also slightly higher than some other councils, given that we are a county. I would say from general comparison and experience in local government, that's probably towards the upper quartile in terms of performance. So compared.
So you're quite content.
Always room for improvement, Councillor Hunt. I recall that we were around 6 days when I was last here in the county council, so I'm confident.
And then you came.
No, that was when I was last here, and then I went away and it dropped. So hopefully it can go back again. Thank you.
Okay, thank you.
Thank you. Councillor Netzinger.
Thank you. And like Councillor Hunt, some of my questions have been answered, but I'm just going to go back to the questions about the mental health and stress and the impact of that on workforce absence. And it is quite interesting looking that those things appear in both the long-term absence and the short-term absence, and presumably one of the things that we actually want to do as an employer is move more people into the short term rather than the long-term absence bracket. It would be nice if people were not getting ill at all, but it is good for our staff as well as for our organisation if when people do get unwell, they move back into work as quickly as possible, and that tends to be good for the individuals as well as for us. So I just wondered what work is being done within the organisation to try and understand how we try and support staff so that they feel able to talk about stress and mental health and then come back into work with support rather than ending up in that long-term category, which I think is the thing that is actually particularly damaging for us as an organisation and for the individuals concerned. Thank you.
Thank you. So I think we're doing a few things. First of all, I think people are much more able to say when they are suffering from poor mental health now, which some years ago they couldn't, and we would see much more absence in the musculoskeletal side because it would show itself as a back pain or whatever. So I think it's really good that people are able to say it. We have the hour conversations on a monthly basis now, and one of the topics during that conversation, an hour with your manager every month, is your well-being. So that's your first point, really, if you haven't had a chance at that point to talk about it. And then we have mental health first aiders, which are quite readily used in the organisation. Like Anna just mentioned, we have Maximus, that's really helping us to keep people in work when they are suffering with poor mental health. So I think overall our sort of understanding of poor mental health and how that might impact on somebody in the workplace is better. We're able to, managers are able to make reasonable adjustments, think about how somebody might be presenting and what sort of changes they might need to make. So I think just a more inclusive and supportive approach is probably making a big difference. But of course, we'd like to see it reduced, but I think the fact people are able to say it is a positive.
Thank you. And I think just to follow that, it's really good to hear about all that work that's happening. And I think if we can start reducing those long-term sickness days, even more than the short-term ones, that will be a really good indicator that we're getting some of that right. So that'd be really good. Thank you.
Thank you very much. I've got a few people who want to comment. Councillor Tierney.
Thank you, Chair. You said you spoke to the desire to make the workforce more diverse. I think that's a laudable aim, and I'm sure what you mean by that is to advertise widely enough that a diverse range of people can apply. But with that being such an important aspect of employment here, how do you guard against introducing an unconscious bias which stops you from perhaps picking the best person for the job by pushing a diversity quota above that, which would perhaps be unhelpful? I think I just want to stress, if you just chose people by being best on the job, you would get a diverse workforce. But I wonder how you guard against that unconscious bias when making decisions.
Thank you. So our dedicated recruitment team run regular training sessions for managers, and unconscious bias is one of the topics that they cover quite openly in that session. So people are able to educate themselves on how that might play out and avoid that. They also do look at adverts before they go out to make sure there's nothing in the adverts that might inadvertently be a barrier for people. And then they can give advice and support around interviews, selection processes. So I think the main way we're tackling it, I would say, is through internal education.
Can I come back on that, Chair? Thank you for that. And I'm sure that's true. But when you talk about people being trained to notice their unconscious bias, what I'm referring to is almost the flip of what we would normally call unconscious bias, isn't it? Because generally unconscious bias has been understood to be a bias against people who are perhaps from some area that people might assume things they shouldn't. So what I'm saying is, how do you guard against the flip side of that? How do you guard against diversity being so important that it becomes the first thing you think of rather than the best person for the job?
Janet, would you like to?
Yes, perhaps if I can just come in on that as well. I think the key is that we're trying to, as Caroline said, we're not in the business of positive discrimination. So what our challenge is to systematically try and remove all the barriers that might exist, perceived or real barriers in the system, so that we attract as diverse a pool of candidates, as you said, as possible. And then our role is to select the best person for the job, regardless of, you know, what background they have. So it's about just trying to remove the barriers and then select the strongest candidate for the role.
Thank you. That's very reassuring.
Thank you. And I believe the Chief Executive would like to add to this.
Thank you, Chair, and Councillor Billington knows exactly where I'm going to go with this response. So, first of all, just in response to Councillor Tierney, to confirm that Cambridgeshire County Council does not operate any system of quotas. As Janet has rightly said, we might take positive action, but we would not take any positive discrimination steps that were outside the provisions of the law. In terms of the issue of unconscious bias, yes, it's helpful we draw that to the attention of recruiting line managers, but there is actually empirical evidence out there from academics in Middlesex University that proves that unconscious bias training is actually ineffective in terms of changing perceptions through the recruitment process. Now, interestingly enough, having applied unconscious bias training in the NHS, the metrics didn't fundamentally shift in terms of the inclusiveness of the workforce. So I guess it's one of those things that we just need to guard against. It's another area for recruiting line managers to be aware of, but the evidence about whether or not unconscious bias training actually has any impact is questionable at the moment, I would suggest.
Thank you. That's a very interesting insight. Councillor Shaler.
Thank you, Chair. I notice on the short-term absence reasons, there's some, I think, a little above 12% for COVID and quite a bit on for other ones. Having had a flu virus vaccine yesterday, and I know we have a great program of COVID vaccination within the county. Do we have any data that shows how effective this is, or if it could be more effective? In terms of reducing some of those numbers?
Who would like to answer that? Janet?
I'll take the question. I'm not sure I can answer it, I'm afraid. So we don't, we've actually stopped now recording. Going forward, we won't be recording COVID related absence separately anymore because well, I think we all know, don't we, that people don't always know when they've got COVID anymore, and so things come through it. So it will be linked in with respiratory illness and colds and coughs and so on. But nor do we haven't recorded who had a vaccine for a long period of time either, I'm afraid. Having said that, we do encourage people to get their vaccinations, and certainly our frontline staff have been encouraged to take those up and also to take up flu jabs where they're offered. Yeah, thank you.
Thank you. Chief Executive.
Chair, just to agree with what Janet said, I think for the benefit of Councillor Shaler, just to say that in line with the national guidance, public health, as Janet has said, has stopped both the recording of incidents and effectiveness reviews of vaccination. That's now a matter entirely with the UK Health Security Agency and the Department for Health and Social Care to consider. Thank you.
Thank you very much. Councillor Billington.
Thank you, Chair. Just looking at the long-term absence again, if I may, that anxiety, mental health and depression is swiftly followed by stress. Surely stress also is a form of mental health issue, and therefore those two statistics together are quite large, i.e. I can see 40% nearly causal percentage, which seems rather a lot. Having said that, I congratulate you on the interventions you are putting into place. And I might just suggest that perhaps something I've used in the past in an organisation was occupational health intervention. So somebody went off today and said they were off with stress. They would expect a call from occupational health the same day or the day after. And the same for musculoskeletal, and that reduced significantly the absence length. And of course, with mental health, the longer they're absent, the longer they will be absent, and the more difficult it is to get back into the workplace. So just make those few suggestions, but well done and congratulations on what you are doing. Thank you.
Thank you very much. Are there any other comments? I've got a question really, which may it may be that it's part of what you bring back later, but it's a lot of times mental health and stress problems are an outcome of, you know, the work-related stress. So there's something to do with the work environment, whether that is interaction with colleagues, with management style, interaction with the public, or what have you, misfit with the job. How far do you go in exploring those sort of causes, if you like?
Yes, absolutely, you're right. They can be completely linked to work. We have various tools that we can use. We have stress MOTs that we work through line by line, and that helps to identify what the problems are, where they've come from. And then we have different policies and approaches that we can do to try and resolve things. So we have a respect at work policy if the problem is around the behaviour of between colleagues. We have a resolving workplace concerns policy, where we can follow and investigate and find conclusions. Facilitated meetings to try and, particularly, I think, like was mentioned before, around the earlier you can intervene, the better, and that will resolve it. So I think we have a variety of tools available to us, and managers are good at using them now. So
that's really helpful to know, and it might be good to somehow evidence that activity is going on. I'm not sure how that would be done, but in a sort of anonymous way, but it might be helpful, because that is getting to the root cause, if you like. It may be someone's just in a job that doesn't suit them, in a way, in a sort of really profound way, and that also needs addressing. Are there any other comments or feedback? If so, can we note the detail of this report? And thank you very much. Excellent report. And move to the next item, please, which is the gender pay gap. Again, could we have an introduction to the report, please?
Thank you, Chair. So in this report, we are referring back to data from March 2022, so a snapshot of the organisation as it was in March 2022, and which you will have seen prior to its publication in March 2023. What didn't happen then, and hence this follow-up report, is a deeper dive analysis, which you have attached as Appendix 1, looking at some of the analysis that we can provide to you about what we know about our pay gaps, and where we have taken some action and where we plan to take more action to try and reduce those pay gaps, whether that be in relation to gender or ethnicity. At the moment, in March 2022, our mean pay gap reported for the year was 8.8%, and the median was 8.2%. You'll see those in figures 1 and 2, along with our quartile pay gap data in figure 3. Some of the things that I would draw out of that report are, we do have some disparities in each pay quartile. We know that the difference in male and female pay nationally tends to be greatest among high earners. So that's something we need to bear in mind. And the things that are in this report, we bear in mind that we will also take back into both the People Strategy Action Plan and the EDI Strategy Action Plan as it relates to workforce. We have seen improvements in terms of parity of starting points. There's always a bit more work that can be done, but we have seen from this deep dive that is getting better, by which I mean they're as closer in terms of men and women where they are starting in the organisation, in terms of either starting at the bottom or the top of the pay scale. So we used to see bigger gaps in that, and some of the recruitment training that Caroline's referenced will have supported that. We've also similarly seen improvements in how closely rated males and females were in their performance ratings in the relevant year. Our data for over and under age 40, the median pay gap there is better. We would still pay attention to the over 40s and looking at that intersection between age and gender, because you will see a disparity there. And in terms of ethnicity, because we've reported on the ethnicity pay gap as well, probably the biggest thing I would pull out there is that the biggest thing we can do is to keep strong messaging around the importance of disclosing ethnicity. So encouraging and supporting a culture in which colleagues can tell us their ethnicity, and so that we have that on record and we have a fuller picture of the demography across our organisation, so that we can then build a better picture when we are reporting on our ethnicity pay gap. So we know that there's work that we're continuing to do around letting people know how they can tell us and what we do with that information, so that people trust why we're asking them to tell us that. There may be things that you're going to be more interested in. We are coming into a period where we will be calculating our pay gap as it was at March 2023. We will be working with the PI team and calculating that over the coming months, and we will then be bringing that to report on in February, March 2024. So there may be things that you would like to see or you'd like to see in more detail, and I'm very happy to listen to questions or feedback on that. Thank you.
Thank you very much. Another excellent report. Thank you very much for presenting the highlights. Do we have any comments? Questions? Councillor Netzinger.
Thank you. I always find this report fascinating. There are lots and lots of fascinating things about it. And it would be wonderful to ask for a report twice as long on all sorts of different bits of our workforce. It does sort of tell you as much about what our internal workforce is as it does about gender pay gap, because I know we've had conversations in the past about why there are some of the gaps between us and some of our neighbours, and some of that is about who they employ in-house rather than have as external employees and things like that. But I am going to make a point which I've made in previous years, which is that looking at, I mean, it's very clear from these figures that we have a very, very heavily dominated female workforce. Looking across the council's workforce and what we provide and what we do, that's not massively surprising. But I do think that thinking about recruitment, trying to encourage more men to come into some of the sectors which are female dominated is something that we should be really thinking about, because actually there are lots and lots of men who would be fantastic as in the kind of communities work and caring work that is so much of what the council does. And I think trying to work out how we do more recruitment into the lower levels of pay in our organisation among young men is one of the things that we should be thinking about as much as what we do about gender pay in other ways, if that makes sense. And I know I've said it before, and I don't know whether we're doing anything about it. And we have just had a conversation about unconscious bias. But I do think that thinking about whether we're doing everything we can to make our kind of entry-level jobs as attractive to young men as we possibly can is potentially something we could be doing more of. So just a thought.
Would you like to comment on that?
Yeah, thank you. And that's it's a very interesting point to make, actually, because I sometimes get too much into the high earners side of things, and actually making that representation at all levels is equally important. Reflecting on, we are providing compassionate and inclusive leadership training for our leaders, and one of the elements of that I'm thinking back to when I've been on this recently is about the imaging that we use in our recruitment materials, and about telling stories from colleagues and making sure that those are representative. And perhaps that is something that we could think about action plan wise, in terms of making sure that we are showing a diversity at all levels of role, gender wise as well as anything else. So food for thought.
Yes, please.
While you're thinking about that, you might also, I have talked about young men coming in at those kinds of levels. It shouldn't just be young people. And I can't remember where we were having a conversation about, where I this week have been having a conversation about trying to make sure that we are bringing more people in their 40s and 50s who might have left the workforce for a variety of reasons, some of which will be to do with mental health and stress, back into the workforce. So when we're thinking about those that kind of recruitment and the materials that we're using for recruitment. I think it's so I retract the young part of my conversation on men.
Thank you, Janet. Would you like to add something?
Yes, just one more thing to add, if I may, around the work that's ongoing, and that's with our ICS partner colleagues. So as part of the workforce strategy across the ICS, we are looking at entry routes into health and social care professions, and that's something I think we can absolutely take into that, is thinking about how we make those careers more attractive and more engaging for the male workforce as well as female. So thank you for that.
Can I follow that up? Sorry, I have now remembered where I was having that conversation, and it was at the Combined Authority Skills Committee on Monday, where we were talking about how we encourage people who are not making career progression in the way that they potentially could do. We were talking about disadvantage in the north of the county, actually, and how we encourage people from communities where they don't necessarily think they've got the skills to become managers, for example. How do we encourage them to take those steps? And I think there are a whole range of different things that it would be interesting for us to think about in our with regard to our workforce and our recruitment, about how we encourage people to take the next steps or different steps in their careers. Thank you.
So I'm afraid that adds to some of the proposed actions that you've got. I've got Councillor Hunt, then Councillor Tierney.
Bearing in mind that you've got 80% of the staff are female and 20%, does that actually make it very difficult for you to do your job? I mean, do you count one male's opinion as 4 times more important than a female's opinion? Because if you're interviewing, if your staff is so unbalanced, how do you make the difference? Or does it mean that if one male says something, it has an enormous impact and it skews all your figures? Do you actually give males sort of a larger volume of points than you do females, because you're trying to get to an equal situation? I can see it just being a nightmare.
Yeah, I think we can answer that.
Quite simply, no, we don't. I think we have moved quite a long way in terms of the way we operate within the organisation, and that we are represented. The gender balance is not, as you've seen, it's not even. We're a long way off that. But I think just the simple answer is no, we don't operate in that way. Everybody has an equal voice within the organisation, and I haven't heard any issues being raised about that. So not one that we need to worry about, thankfully. Thanks.
Thank you very much, Councillor Tierney.
Thank you, Chairman. When you get to the end of analysing your data and you look at what you've discovered, you're looking at a difference between the pay between genders or between any other 2 demographic groups that you're looking at, and you come to the conclusion that one group is paid more than the other, which you believe is unfair. I'd just like to say that one of the ways you could address that will be to pay the group that's being paid more less, so that you bring them down to the level of the other group rather than paying the group that's lower more. And that simultaneously will make it fair while easing the pressure on the taxpayer, who seem to have to pay more every year. Thank you.
Thank you. I mean, that's an interesting point, but of course what we have the privilege of doing is seeing what the data is in aggregate. And it's only when we get aggregated figures these trends become obvious. But then we have to have an iteration to go back to our processes and policies and make sure that they are being followed fairly, so that the data that we end up seeing can be modified over time. I think it's a sort of quite a long-term iterative process. Yeah. Councillor Netzinger.
I just want to check whether I heard that right. Are you really suggesting that we pay our male staff in the county council less than our female staff in the county council, given that we only have 20% of male staff already? It seems a very, very peculiar suggestion, Steve.
Through you, Chair.
Councillor Tierney, if you would like to answer that, please.
Well, I wouldn't want to speculate on what the final results of the data are going to be, and I wouldn't like to specify one group above another. I would simply say that if you find there's an imbalance, there are 2 ways to deal with it. One is to pay one group more, and the other is to pay the other group less. But both end up with the 2 groups being paid the same, which I think you would agree was fair. So that's what I would do, because in the end, otherwise the constant pressure on the taxpayer is to have to pay more and more and more. And that's not affordable, especially not in the current crisis. Thank you.
Thank you for the comment. I'm sure it's noted. Any other points? Councillor Shaler.
Yeah, there is a slight confusion here, I think, Chair, between job choice and just comparing groups with groups. And there may be a point that some jobs should be paid better than they are currently being paid, or something. But just a kind of a flippant comment perhaps, but it gets worse north and east. What's happening in Norfolk and Suffolk? They seem to be worse than us. Can we learn anything from that?
I'm not sure we have a lot of insight into those areas, but are there any points that you've gleaned that you might, or would you like to answer? Who would like to answer? Anna.
I'll just say one thing, which is in terms of looking at other comparator organisations, we are in the process of contacting each of those organisations and asking, is there any best practice that we can share, where we've got organisations where we can see that on the face of it, their pay gap data is better. We can't always, it's a bit of a crude measure. So it might be that, as I think Councillor Netzinger mentioned, that there can be differences in terms of who those organisations employ, the nature of roles. But if there is learning to be had, we will be looking to gather that.
That's really helpful. Thank you. So I think we've aired quite a lot of views and comments and questions. It's been really helpful to see the report. We're just asked to note it. So can we note it and move to the next item? Thank you very much. Thank you for the report. Excellent. The proposal is that for the next two items that we exclude the press and public. And I am proposing that. And it's on the basis that it would not be in the public interest for information to be disclosed, information relating to an individual, information which is likely to reveal the identity of an individual, information relating to the financial business affairs of any particular person, and information relating to consultations or negotiations or contemplated consultations or negotiations in connection with any labour relations matters arising between the authority or a minister or office holders under that authority. So do I have a seconder? Thank you, Councillor Netzinger. Can I ask any member who does not agree with this proposal, please raise their hand? Nope, I think we are now moving into confidential private session. We just have to make sure that we are disconnected.